Hello, my name is Jim VanderSteeg and I'm the CEO of Covenant Health, and I just want to take a few minutes to share a few things with you I think that are important. One is about the future of Covenant Health, and the other is about the fact that we maintain a patient focus at Covenant. This is a unique time. My guess is many of you that are listening to this are struggling. You have families that are struggling. You have friends that are worried about their future. But what I would tell you at Covenant, this is also an exciting time. You may be wondering, why am I excited about the future? How can I, during this time of what seems to be a storm, have a perspective, a bright perspective toward the future? And I want to tell you a couple of things. Number one is Covenant is financially healthy. As you look at organizations across America, including healthcare systems, some of them are struggling financially terribly. I will tell you, this has been a difficult financial time, but because Covenant has planned for its future for many, many years, we weren't built for a day, we weren't built for a year, we were built for the long term. Covenant is financially strong, and I think that's very, very important to everyone on this who's listening to this. In addition, I will tell you this, while we've been obviously having to deal with COVID and what that means and the stress it's created in your lives and in this organization, we have kept working on our strategies, and some of those you've heard about. Continuing to move into our strategic partnerships, a new relationship with an organization called Encompass, which will be partnering with us for our Patricia Neal Rehab Center, where we will work together. We will completely rebuild the downtown facility to take care of high acuity patients. But then in addition, we're going to build another hospital on the campus that I sit on today, which is Fort Sanders West. And so we're offering more and better services to our community. And so what I want you to understand, while I fully understand and appreciate the challenges we're dealing with, we continue to drive the strategies that are going to make us successful in the future. So next year is an exciting year for Covenant. We're going to celebrate 25 years. We actually have one of our hospitals, Fort Sanders Regional, that just celebrated 100 years. Most things that are 100 years old are a museum. If you look at what's going on in our organization, we're growing, we're adding facilities, we're adding technology. And so next year, 25th anniversary, shows you what it means to plan towards your future. I want to mention a few things that are really exciting and investments that are being made in our organization that I think are going to be very, very important for our future. A lot of you know some of these, but I want to mention them real quick. One, at Park West, we just finished a new wing in the hospital, added new surgery, and we're also right now in the process of building out new CV space and some other things. Over a $100 million project. In addition to that, Fort Sanders Regional just opened up a new emergency room, and we're in the process of finishing the new ICU, again, over a $100 million project. And then also a new strategic relationship between Patricia Neal, our organization, and Encompass, where we will spend over $15 million to enter into a new relationship, where in totality we'll spend over $50 million building out a new Patricia Neal downtown at Fort Sanders, and then a brand new hospital on the Fort Sanders West campus. The most important part of Covenant's vision is that patients are first. And during this time of COVID and the pandemic across our country and across our world, one of the things that excites me the most, and in all honesty is the most rewarding, is to see we've never lost the focus on the patient. Whether that has been protecting the patient during the time they're with us, or really how we're performing overall. If you look at our quality metrics during this time, they've actually improved. We've actually gotten better at all the things we focused in that are important to our patients as we take care of them. One of the important things we've done in our organization in order to continue to focus on the patient is we just recently hired a vice president of patient experience. That person's sole job will be to work with the teams across the organization, continue to focus on the patient, and improve our patient satisfaction. Covenant's patient satisfaction overall is good. In fact, in some ways it's very, very good. But we're not as good as we need to be. And this individual's sole job will be to work with us as teams to help improve our patient satisfaction. While all these things that I've announced are very exciting, the reality is the most important thing is that patients get excellent care at Covenant. My vision for Covenant is regardless of where you go, whether it's a clinic or a hospital or receive an outpatient service, that you will have the same great experience. Covenant Health is a healthcare delivery system. That means we're made up of a lot of different things. We're clinics, we're outpatient diagnostics. We have 9 hospitals, and really we have 10 because one of them is a behavioral health hospital. And over the last couple months, I've had a chance to go to all those hospitals. And let me tell you what I've seen. Everywhere I've gone, everywhere I've seen creativity. And even more important than that, what I've seen is that everybody has a passion to take care of those we serve. Healthcare is a unique place to work. It's not just a job, it truly is a calling. And I've seen that in the experiences that I've had across our system. You all work together in a way that is really amazing. And in all honesty, the patients see it every day. I want to thank you for the time and energy that you give to this organization every day. You're making a big difference.